evil.
Subscribe now. Type 1 diabetes, which used to be called juvenile diabetes, is a chronic lifelong autoimmune disease in which the beta cells in the pancreas islets of the Langerhans produce too little insulin to regulate blood sugar levels. Without adequate insulin, glucose builds up in the bloodstream instead of going into the body's cells. The body is not able to use this glucose for energy despite the fact that there are high levels in the bloodstream, which leaves the person feeling hungry. Additional symptoms include thirst, increased urination, weight loss, nausea, and fatigue. There is one new case per year for every 7,000 children, but the exact cause of juvenile diabetes is a mystery. Genetics play a role, but cold weather and viral infection are thought to be possible environmental factors as well and may trigger an autoimmune phenomenon leading to the destruction of beta cells in the pancreas. 7% of the population of the United States, or 21 million people, have diabetes. About 5 to 10% of those cases are type 1 diabetes. Most Americans who are diagnosed with diabetes have less serious type 2, formerly called adult-onset diabetes. The good news about type 2 diabetes is that many cases can be controlled by diet, weight management, and exercise. But patients often still need oral medication or injected insulin to achieve effective control of their condition. A recent phenomenon has been marked increase in the incidence of the young people being diagnosed with type 2 diabetes, which correlates with the epidemic of childhood obesity. Many of them are within the age range once associated with type 1 diabetes, and this helped lead to the dropping of the juvenile and adult onset levels. A diagnosis of diabetes is confirmed by a fasting blood test. A patient does not eat anything for 12 hours before the test. Water, tea, or coffee is acceptable, but skip the milk and sugar. Treatment takes two forms: insulin injection to regulate blood sugar levels and treatment for diabetic ketoacidosis, which can occur when blood sugar levels do get too high. At around 240 milligrams per deciliter, the body looks for other energy sources and uses fat as a fuel source. The fats are broken down and acids called ketones build up in the blood and urine. DKA is a dangerous situation and accounts for most of the hospitalization due to diabetes. DKA can lead to heart and kidney disease, retinopathy, and neuropathy. The long-term goal in living with diabetes are to reduce the symptoms and prevent diabetes-related complications such as blindness, kidney failure, and foot or leg amputations. The ultimate goal, of course, is to prolong life and to make their life as comfortable and meaningful as possible.